So we have been asked whether Indian toilet and Western toilet in comparison, what is better, what is superior, and does Western toilet doesn't cause knee pains. So it's not like Indian toilet or Western toilet. Indian toilets are when we see patients from MN, the patients say that it is Arabic toilet, and when patients from African countries, they say that it is African toilet, and we say that it is Indian toilet. In Indian toilet, it requires especially Indian toilet or African toilet or Arabic toilet. When the patient is rising from sitting position, the patient will exert a lot of pressure on his knee joint and hip joints, and there should be extreme movements at the hip joint and knee joint. So in these conditions, the patient may have severe pain, especially if the patient is already having a meniscus tear or osteoarthritis of the hip joint or osteoarthritis of the knee joint. These particular positions will further aggravate the condition, and the patient will have severe pain. Just to avoid that condition, we advise the patient to use English toilet or Western toilet. In such conditions, the amount of pressure that falls on the hip joint or knee joint is reduced significantly, and the patient will be able to avoid the pain that otherwise would have been caused because of these Western Indian local commodes, local toilets, local commodes. So when coming to the next point, that is which toilet is better. Ideally, for a healthy person where there is no issue with the hip joint, no issue with the knee joint, Indian toilet or African toilet or Arabic toilet, they are better, because they will allow complete emptying of the bowel and there is no sphincteral tension there. But when it comes to English toilet or this Western toilet, Western commode, we advise that because when people are having severe osteoarthritis of the knee joint or hip joint, or they underwent surgery for the knee joint or hip joint, actually in some cases we do advise the patients to take a 6 to 8 inch seat rise on the Western commode itself, so that the knee joint and hip joint movements are further relaxed and further we can avoid the pain. So it is just to avoid pain that would have otherwise caused, that is hampering them from flexing their knee or hip to a more degree. We advise them to take English commode. Otherwise, for healthy adults, local Indian commodes or African commodes or Arabic commodes, they are good enough.